Channel 8 Eyewitness News, the news leader.
In tonight's Channel 8 Medical Breakthroughs, a new drug will soon be available to help prostate cancer patients. The drug Eligard is injected into patients. Eligard is a hormone therapy that reduces testosterone levels in patients. In some patients, reducing those levels can limit tumor growth. The hormones in the drug are released into the body over the course of a month. Researchers have not found any significant side effects of the drug.
We're doing a story now on prostate cancer, and we want to give you a little background on it. 1 man in 6 will be diagnosed with prostate cancer during his lifetime. According to the American Cancer Society, prostate cancer is the most common cancer, excluding skin cancers, among American men. Almost 190,000 new cases will be diagnosed in the U.S. this year. Now, a new delivery system allows medication to be given to patients using a small needle just under the skin, which may be less painful to patients and given only once a month. Joining me now is Dr. Franklin Chu, who is one of the founding members of the San Bernardino Urological Associates Medical Group. Beside him is Quinton Doswell, who was a prostate cancer patient. Welcome to you both. Thank you for joining us.
Thank you. Good morning.
Dr. Chu, tell us about this new treatment, Eligard.
Tristan, I can't agree with you anymore that prostate cancer is the commonest cancer in male, and this year 31,000 men are going to die from prostate cancer. So the urology community as a whole is continuously trying to strive for better medication. And Eligard is a new agent that's developed to lower the male hormone level in prostate cancer patients so that we can stop the progression of prostate cancer. It is extremely effective. It is actually the only agent in its class that 100% of the time will suppress the male hormone level so low that no other medications needed. When we use the strict National Comprehensive Cancer Network guideline, it uses a very small needle and delivers a very small amount of medicine directly under the skin. So it is extremely patient-friendly. It has very little pain as compared to the 2 other medications that's on the market.
Dr. Chu, do you believe this product will cure prostate cancer altogether?
Oh, I don't think it's used to cure prostate cancer, Tristan. It's used to control prostate cancer. In general, it is given to patients who are not candidates for definitive treatment, usually because they're older. It is also used in conjunction with radiation, anywhere from 6 months to 3 years. And in certain cases, the surgeons will use it either before and or after the surgery to help control the cancer if the cancer is really bad.
Very exciting time for you all, I'm sure. Quinton, let me ask you, how did you first learn you had prostate cancer?
Tristan, I was diagnosed with prostate cancer at the age of 51. And just to tell you a little bit more about my story is that I have a strong family tied to prostate cancer. My father had it, my uncles had it, and my father-in-law died from it. And I have 2 sons and 2 grandsons, so I'm very concerned about prostate cancer. And if I had to give a message to men, go see your doctor and get your checkups.
What do you think, Quinton, of this new product, Eligard?
I'm a living example that Eligard works because I did have advanced prostate cancer. And my father had the old treatment with the deep intramuscular injections, but the Eligard was easy to handle. I had this small needle, and I didn't have any pain in my 6-month trial.
Quinton, you've really hit on something here. I think this is one of these topics that I think education seems to be the key. What would your final thought be for men out there who are seeing this report this morning? What would you say to them?
I would say, men, go see your doctors, get your checkup. A diagnosis of prostate cancer, while devastating, does not have to be a death sentence. There's modern medicine, there's great techniques, and today is the day to do that.
How are you feeling now, by the way, Quinton?
I'm feeling fantastic. I'm having a full life. I'm enjoying my wife. I'm enjoying my grandkids and my son. I'm vacationing, and I'm happy as I can be.
Oh, Quinton, that's great. We're happy to hear that. Dr. Chu, any final thoughts for us this morning?
No, I think I'm very proud of Quinton, and I'm excited about this new treatment, which is extremely patient-friendly.
That is fantastic. Well, gentlemen, thank you so much for joining us this morning. We certainly appreciate your time.
Nice talking with you.
Best of luck to you, Quinton. And for more information about the advanced prostate cancer treatment, log on to our website. That's www.wingtv.com.
You're watching WFMY News 2. Welcome to the Good Morning Show.
Well, other than skin cancer, prostate cancer is the most common among men. There are very effective treatments on the market, but one new one called Atrogel offers the benefits with less of the discomfort. Joining us to talk to us about it this morning is Dr. Franklin Chu and Quinton Doswell, Jr., who is a cancer patient. Good morning to you both, gentlemen. Good morning to you both. Can you hear me? Apparently we're having some problems with the satellite hookup here. We will try again in just another second. Perhaps our producer and their producer can get together as to whether or not they can hear me, but I'll try one more time. We're talking about prostate cancer this morning. About 1 in every 6 men are diagnosed with this in their lifetime, and it is one of the most common, as we said, cancers other than skin cancer in men. So we got Dr. Franklin Chu and Quinton Doswell, Jr. with us this morning. Quinton, by the way, is a cancer patient. Can you hear me now, gentlemen?
Yes.
Yes, we can.
Right, fantastic.
Good morning.
Good morning to you both. Dr. Chu, we'll start with you and just say from a medical standpoint, how big is it that Atrogel is supposed to be less pain and a better mode of giving these medications?
Robert, Eligard is a new agent developed to lower the male hormone level in patients, and certainly it's very effective in doing that. It is the only agent that lowers the male hormone level so low that we do not, that at 100% of the time, we do not have to use any additional drug if you follow the strict National Comprehensive Cancer Network's guideline. We use a very unique delivery system that allows us to use a very small portion of the drug that's injected directly under the skin, and because of that, we can use a very small needle, and the medication is delivered directly under the skin. So it is very patient-friendly, and it is very effective.
In that regard, what we've heard before is that the other forms of the medicine and the other treatments for prostate cancer have in the past been a much larger needle.
Medication, the patients who were exposed to Eligard, and then because medicine was not available, they had to use the medication that's on the market. They clearly preferred Eligard for patient comfort.
All right, doctor, actually what I was getting into there was that the previous forms of treating prostate cancer were a much larger needle and into one of the deep muscles, so it's a lot more painful. So why don't we talk to Quinton Doswell, Jr., who is a cancer patient, and I am assuming that you have had the Eligard through the Allogel form. So just tell me as a patient how this has been for you.
Well, yes, Robert, I have had the treatment. I'd like to give you a little background of my story. I was diagnosed with prostate cancer at the age of 51, and I didn't realize I had such a strong family tie. My father had prostate cancer, my 2 uncles had prostate cancer, and my father-in-law died from prostate cancer. And I have 2 sons and 2 grandsons, so I'm very concerned about the treatment. And my message to men would be, go see your doctor, get your blood checked. Because it's a disease that men don't want to talk about. It's a very personal disease, but men need to get themselves checked.
All right. Well, we thank you both for joining us this morning. Quinton, best of luck with dealing with this cancer. And Dr. Chu, we certainly hope that it'll continue to help patients out there of yours. Thanks both for joining us.
You know, I'm sitting here thinking they keep saying tomatoes help prevent prostate cancer. Well, it's homegrown tomato season.
Now, from the desert's news leader, KESQ News Channel 3 in the morning with Jeff Stahl, Colleen Sullivan, and Ginger Jeffrey.
30,000 men will die from prostate cancer this year. Now, that is the latest information from the American Cancer Society. They add prostate cancer is the 2nd most common cancer among men. But there is some good news this morning. Treatment for prostate cancer is making leaps and bounds. With details about the new treatment, we're joining Dr. Franklin Chu live in Orlando, along with his patient, Quinton Doswell. Good morning, gentlemen. How are you doing?
Good morning, Ginger.
Good morning, Ginger.
Well, Dr. Chu, let me...
You're so right.
Go ahead, I'm sorry.
Prostate cancer is the commonest cancer in male. And you're right, 31,000 men will die this year. And we are always striving to have better medication and better treatment. Eligard is one of the new medications developed to combat prostate cancer. It is in a class of drugs that's used to lower male hormone level in prostate cancer patients, which will control the growth of prostate cancer.
Well, Dr. Chu, let's back up for just 1 second. First of all, talk with me a little bit about the disease. 1 in 6 men in their lifetime will be diagnosed with prostate cancer. What are the contributing factors? Is it age? Is it diet? Is it exercise? What is it?
Ginger, you're right on. It's all three of them.
Oh.
It's related to age, it's related to diet, it's related to a lifestyle, and it's also related to certain races. African American men seem to have more aggressive prostate cancer. Also, if you have family members, especially very close family member, have prostate cancer, you're certainly more likely to develop prostate cancer.
And so what about...
we,
go ahead.
urologists always ask all the patients, go get screened. You should be screened once you're over 50. And if you're African American, you should be screened after you're 45. And if you have family members with prostate cancer, you should be screened even earlier at 40 years old.
And so you're saying once a year at 40 years old for African American males with it in their family, get screened once a year.
That's correct.
Okay, now Quinton, I understand you are a prostate cancer patient. Tell me about what's happening right now with your treatments.
Well, Ginger, currently I'm not taking any treatment for prostate cancer. I took treatments 3 years ago. I was on a clinical trial with the Eligard. I was diagnosed at the age of 51 with prostate cancer, and I'm one of the people that has a close family tie with the disease.
Ginger, let me jump in here for a second. Quinton was diagnosed with prostate cancer very early. As far as age-wise, that means he has a very aggressive cancer. He had radical surgery, then we gave him radiation. In addition to the radiation, we decided to give him some hormonal treatment to lower the risk of recurrence. And in his case, at the time he chose to have Eligard, at the time it was a clinical trial medicine because it has a much smaller delivery system. It caused much less discomfort to the patient as compared to the 2 drugs that was on the market. Quinton, I want to add, Quinton's father had prostate cancer and had to have one of the other medications which used very deep intramuscular injection, and that obviously was the main factor he decided to do the clinical trial rather than use the conventional medicine at the time.
Well, and the earlier treatments are much more painful, so is this new treatment that Quinton is on, is that now available for everybody?
Yes, the new treatment now is available for everybody. It's been on the market, I think, since the last month. But again, I would encourage the patient to go to ask their doctor whether they are a candidate for this treatment or whether they should have more definitive treatment. In general, younger men should have either surgery or radiation. Older men, especially men over 75 years old, would have mainly this class of medicine to lower the male hormone. And when we give radiation, patient also gets at least 6 months or sometimes up to 3 years of this treatment. And in certain patients like Quinton, when the cancer can be very aggressive, we also add hormone treatment in addition to surgery.
Quinton, have you talked with...
also that I'm doing quite well today. I'm cancer-free.
Wow,
I'm living a full life. I'm enjoying my wife. I'm enjoying my family, and I'm blessed. The message that I would give to men is that prostate cancer is not a death sentence. See your doctor and have your checkups. That would be my message to men today.
You are certainly a success story, Quinton, and we enjoyed hearing from you this morning. So thank you, gentlemen, for joining us live from Orlando.
Thank you, Jen.
This is News Channel 5, today in St. Louis, where the news comes first, with Art Holliday, Jennifer Blome, and meteorologist Scott Connell.
It is 5:41. Just ahead, a look at this morning's business news.
And tens of thousands of men die from prostate cancer every year, but a new treatment could mean new hope for men with the disease. We'll have details coming up. Stay with us. 1 man in 6 will be diagnosed with prostate cancer during his lifetime, and this year alone, 30,000 men will die from the disease. And there is a new treatment available. My guest today is Dr. Franklin Chu. Thank you very much for joining us, Doctor.
Thank you.
Tell us more about this new treatment.
Yes, like you said, we are constantly trying to improve the outcome of our prostate cancer patients. Eligard is a new treatment we use to lower the male hormone level in prostate cancer patients.
So why is it better than old treatments?
It is equally effective as the old treatment, and if you look at the strict National Comprehensive Cancer Guideline, this is the only agent that lowers the male hormone level low enough that you will not need any other additional treatment at 100% of the time. And it also is it uses a very unique delivery system. It delivers a very small dose of the medicine directly under the skin. It uses a very small needle. So patient comfort-wise and user-friendliness, it certainly is a medication that's preferred by my patients as compared to the medicine that's on the market.
Dr. Chu, what are the symptoms of prostate cancer, and is it difficult to get diagnosed?
You know, in general, one should go for early diagnosis through prostate cancer screening, a checkup with your doctor, and a blood test called PSA, because most patients, when they first have prostate cancer, they have no symptoms. One way for the symptoms such as urinary symptom, difficulty with urination, painful urination, or even bone pain, quite often it's too late. So I encourage each and every one of the men out there, once you're after 50, you should have regular screening. And if you have a strong family history, or if you're of the African American race, you should certainly start the screening even earlier. At 40-year-old, if you have strong family history, and 45-year-old if you're African American.
Well, Dr. Chu, thank you very much for joining us. I know this is a subject that everyone in the audience, especially men, should pay particular attention to, and hopefully you have a great day.
Thank you.
Thank you, Doctor.
First on Fox 6, good day, Alabama. We've got 189,000 new cases of prostate cancer that are diagnosed every year. It's a disturbing number. Now, 30,000 men will even die from it this year. We're going to have details on a new treatment for prostate cancer and how one man has been living with it over the last few years. That's coming.
But first, 1 in 6 men will be diagnosed with prostate cancer during his lifetime. The good news is there's a treatment. Details straight ahead.
Exclude skin cancer from the equation, and it becomes the most common cancer among men. In fact, 1 in 6 men will be diagnosed with prostate cancer in their lifetime. Now, this morning, finding new treatments for the disease, Dr. Franklin Chu and Quinton Doswell Jr. join us live. Thank you very much for being with us today, gentlemen.
Thank you, Ray.
And let me ask you a question that I will pose to both of you, whoever wants to take it first. How do you rate the current standard of care for prostate cancer patients?
Rick, I'll take a shot at prostate cancer this year will kill 31,000 men. So the urology community and medicine in general, we're always striving to improve our chances with prostate cancer. This new treatment we're talking about today, Eligard, is one of the new agents that's been developed to lower the male hormone level in prostate cancer patients. This will control the prostate cancer. It is very effective in controlling lowering the male hormone level. As a matter of fact, it is the most effective agent on the market as far as lowering male hormone level. It's the only medication that, if you follow the National Comprehensive Cancer Network guideline, that you will not need additional medication. in 100% of patients.
Now, how does it work compared to with prior treatments for prostate cancer?
Right. I think we need to clarify that it's not a curative treatment as far as surgery or radiation. It's used for controlling the cancer as compared to the medicine that's on the market. This medication is at least as effective, but also because it uses a very unique delivery system, we're able to give it in a very small dose directly under the skin using a very small needle. This compared to the existing medication, which either use a very large bore needle under the skin or use a very deep intramuscular injection. This clearly is much more patient-friendly.
Quinton Doswell Jr., let me bring you into this conversation as well. Now, you are a patient, a prostate cancer patient. How's life for you today?
Rick.
How is life for you today, living with
Rick,
prostate cancer?
My life is beautiful today. Just to give you some of my story, I was diagnosed with prostate cancer at the age of 51. And I didn't realize that I had such a strong family tie with prostate cancer. My father had prostate cancer. My two uncles had prostate cancer. And my wife's father died with prostate cancer. And I have two sons and two grandsons, and I'm very concerned about them. And if I had a message to give men today, it would be, men, take care of yourselves. Go see your doctor. Get your checkup for prostate, because it's not a death sentence.
That's one of the things, and I'll wrap up on this. There's that old saying, and just quickly on this, tell me if this is bad, if this is a bad signal passed out. But there's that old saying that the doctor comes into the man and says, the bad news, you have prostate cancer. The good news, you'll live long enough to probably die of something else. Is that good when people hear that saying, when they talk about that in that way?
Rick, it's absolutely true. I always tell my patients, it's bad news to have prostate cancer, but there's always a silver lining, because if we get to it early enough, we can always cure it.
Dr. Franklin Chu, Quinton Doswell Jr., thank you very much for joining us today.
Thank you.
Thank you, Rick.
All right.
Prostate cancer will kill more than 30,000 men in America this year.
Until now, treatment for the disease has been difficult, but that might change with the release of a new drug. To tell us about this new treatment, Dr. Franklin Chu and Quinton Doswell Jr. join us live from Orlando. Good morning.
Good morning.
Good morning.
First, doctor, tell us, how prevalent is prostate cancer among American men?
Prostate cancer is the commonest cancer in men. This year, we estimate there will be 189,000 new cases diagnosed with prostate cancer. And like you said, 31,000 men this year will die from prostate cancer. So we're certainly, the urology community is certainly trying to strive for better treatment all the time.
Quinton, how was your prostate cancer treated?
My prostate cancer was treated with two treatments. Initially, I had radiation. Then I had the hormonal treatment and I was in a 6-month trial program.
I'd like to interject here. Quinton was diagnosed with prostate cancer when he was 51 years old. He has very aggressive prostate cancer. He had surgery followed by radiation, then hormonal treatment. This drug, new drug called Eligard, is in a class of drugs that's used to lower the male hormone in prostate cancer patients, so we can control the progression of prostate cancer. It certainly is very effective in lowering the male hormone level. It is the only drug in its class that will lower the male hormone level so low that no additional drug is needed in 100% of the patients when you go by the strict National Comprehensive Prostate Cancer Guideline. It uses a very small and unique delivery system. We're able to inject the medicine directly under the skin with a very small needle, compared to the medicines on the market, which either needs a very large bore needle or use a deep intramuscular injection. This medication is certainly much more user-friendly, and my patients certainly prefer it.
Sure, and Quinton, how has this new medicine worked for you?
Well, I feel like today I'm a living example. The medicine has worked for me. Let me give you a little history of my situation. I have a strong family tie with prostate cancer. My father had prostate cancer. My two uncles had prostate cancer. And my father-in-law died with prostate cancer. And I'm the father of 2 sons and father of 2 grandsons, so I'm very concerned about prostate cancer. And my message to men would be, get your checkups, because it's a very private, a very personal matter. And men, go see your doctors.
All right, we are starting to run out of time, but doctor, really quickly, can you tell us, will this product actually cure prostate cancer?
The product will not cure prostate cancer. It's used to control prostate cancer. It's generally used on patients who are not candidates for curative surgery. It's used for older men to control the cancer, or used in conjunction with radiation, or in conjunction with surgery when the cancer is very aggressive.
Dr. Franklin Chu and Quinton Doswell Jr. live from Orlando, Florida this morning. Thanks for joining us.
Thank you.
Well, right now it is 6:54 and 65 degrees outside. Thanks for waking up with Fox 7 Morningside.